On one of my recent videos, someone commented and told me that they almost had a stroke, and the reason behind it was because of their tooth. I'm not going to bury this, as this is a very shocking and concerning story. So I decided to make a video on this and to share their story and break down everything that you need to know about how the health of your mouth is linked to the overall health of your body. Hey, my name's Dr. Avi. I'm a retired dentist and entrepreneur. And on this channel, I like to keep it real with you and educate fellow dentists and the general public on different aspects of dentistry. So I'm going to read the comment for you guys here so that way you get an idea of what is going on with this guy. They said, I'm interested in learning more about how dental health affects overall health, in particular, which teeth affect which organs. I recently had a lower left wisdom tooth that broke. It caused severe pain for a while and then eventually stopped. I did not prioritize having it pulled because it no longer bothered me. Soon after, I began experiencing heart palpitations and chest pain at night. Somewhere on the internet, I discovered there was a direct correlation between the tooth and the heart. I immediately made an emergency appointment for an extraction. It cost me $600 out of pocket. My heart issues did not stop after this. My only conclusion is that the information I came across was likely to be true. I'm willing to guess that I'm not the only person lacking this potentially life-saving knowledge. I would love to hear your thoughts and whatever other information you may want to add to this. Yeah, so this is way more common than you think. Look, your mouth is a bustling ecosystem of bacteria with over 700 different species living in there. Most of these bacteria are harmless, but some can cause problems if they're not kept under control. When you don't brush and floss regularly, these bacteria will start to accumulate and add up. Then they form a sticky substance called plaque. Plaque is the main cause of tooth decay and gum disease. If plaque isn't removed, it can harden and turn into tartar, also known as calculus. This is even more difficult to remove. Tartar can irritate your gums and cause them to pull away from your teeth. This then creates pockets where bacteria can thrive. Now, this bacteria that's hanging out in your pockets can enter into your bloodstream, and that's where they travel to other parts of your body. This is where they can cause infections. So as you can see, your mouth is the gateway to your overall health because everything that I listed is extremely dangerous and significant. So keeping your mouth clean and healthy is essential for preventing infections in your body and maintaining good oral health. Now, something I bet you didn't know is that there's a growing amount of research that suggests poor oral health can increase the risk of you developing diseases like heart disease, stroke, and diabetes. Heart disease is the leading cause of death for both men and women in the United States. It's caused by a buildup of plaque in the arteries, which can reduce blood flow to the heart and lead to a heart attack. Studies have shown that people with periodontal disease, also known as gum disease, are more likely to have heart disease than people with healthy gums. This is because the bacteria that causes the periodontal disease can enter the bloodstream and travel to the heart. This is where they cause inflammation and damage to the arteries. Now, a stroke is a condition where blood flow to the brain is interrupted. When blood flow is interrupted to the brain, it can cause brain damage and lead to serious disabilities, such as paralysis and speech problems. Studies have shown that people with periodontal disease are more likely to have a stroke than people with healthy gums. This is because of the inflammation caused by periodontal disease can damage the blood vessels in the brain. Now let's talk about diabetes. Diabetes is a chronic condition that affects the body's ability to use insulin, which is a hormone that helps regulate blood sugar levels. People with diabetes are at an increased risk for developing periodontal disease. And periodontal disease can make it very difficult for people with diabetes to control their blood sugar levels. This is because the inflammation caused by periodontal disease can raise blood sugar levels. In addition to these three chronic diseases, poor oral health has also been linked to an increased risk of other health problems such as preterm birth, low birth weight, and pneumonia. So now that you know all this, how much science is actually backing this up? So the exact mechanisms by which oral health affects the chronic diseases that we mentioned are not fully understood, but researchers believe the inflammation is a key factor in these issues. You see, inflammation is the body's natural response to any injury or infection that you have. However, chronic inflammation, which is inflammation that sticks around for a long time, can cause damage to tissues and organs throughout the body. And that bacteria that comes from gum disease can cause inflammation in the gums and the surrounding tissues. This inflammation can then trigger a systemic inflammatory response, which can then increase the risk of developing chronic disease. If you're enjoying this video, please leave a comment below and let me know what your thoughts are on this. Okay, you hear it all the time from your dentist and your parents. Brush twice a day and floss once, right? But why is this even important? Well, good oral hygiene is essential for maintaining overall health and well-being. Here are the 5 reasons why. It prevents the 2 most common chronic infections in the world: tooth decay and gum disease. Those can cause pain, discomfort, and tooth loss. In severe cases, it can also lead to more serious health problems. 2, it improves nutrition. Poor oral health can make it difficult to eat and chew properly. This can lead to nutritional deficiencies and other health problems. 3, it helps enhance your speech. Good oral health is important for clear and confident speaking, kind of like this. 4, it boosts your self-esteem. A healthy smile can boost your self-confidence, which can then translate to you becoming even more successful in your life. And 5, it reduces your healthcare costs. Guys, listen up. Good oral hygiene can help prevent the tooth decay and gum disease and other health problems. This can save you a lot of money. Look, if you made it this far in the video, I can tell that you value your oral health. That sounds like you, then you need to go watch this video right now because I go over a brand new treatment option that is helping patients improve their oral health by putting plastic in their mouth. I'll see you in there.